Here, physicians will take care of emergency department patients with syncope. This educational module on risk stratification and cardiac monitoring for syncope is brought to you by the Canadian Syncope Research Team, which includes investigators across Canada. First, let's overview the Canadian Syncope Risk Score. This was a tool that was developed to predict the 30-day probability of serious outcomes after emergency department disposition. The serious outcomes include death, arrhythmias, and interventions to treat arrhythmias such as pacemaker or defibrillator insertion, non-arrhythmias such as myocardial infarction, serious structural heart disease, aortic dissection, pulmonary embolism, significant hemorrhages such as GI hemorrhage, subarachnoid hemorrhage, and procedural interventions to treat non-arrhythmias such as surgery for ectopic pregnancy or surgery for a leaking abdominal aortic aneurysm. The tool itself is intended to be applied at the end of the emergency visit and includes 9 predictors, 3 from clinical evaluation, which includes predisposition to vasovagal symptoms, heart disease, and abnormal emergency department systolic blood pressures, 4 predictors from investigation, which includes troponin level and abnormal ECG predictors, and diagnosis in the emergency department, which is the final diagnostic impression at the end of the emergency visit. Was it vasovagal syncope or cardiac syncope? For a patient who is designated as an unknown cause for their syncope, will receive a score of 0 for this predictor. Each predictor will get a score of -2 to +2. The total score for a given patient ranges from -3 to +11. The derivation phase enrolled 4,030 patients at 6 large Canadian EDs from September 2010 to February 2014. The results were published at the Canadian Medical Association Journal, and the link to the full article is given at the bottom of the slide. The tool was validated by recruiting 3,819 patients at 9 large Canadian EDs from March 2014 to April 2018. The results were published in JAMA Internal Medicine, and the link to the article is given at the bottom of the slide. Based on the total score of the patient, their risk can be categorized into 5 main categories: very low, low, medium, high, and very high. As you can see in here, this table shows the 30-day serious outcomes for the various risk categories. The overall 30-day serious outcome ranges from 0.3% for the very low risk category to 42.7% for the very high risk category. Additionally, the Canadian Syncope Risk Score also tells us the type of outcomes in each of the categories in the form of deaths, ventricular arrhythmia, supraventricular arrhythmia, or a non-arrhythmia. The prediction of overall serious outcome and the specific outcome types will help us to decide disposition for the patients in these risk categories. And this brings us to our first question. For patients among whom no serious underlying condition was identified during the emergency department evaluation, will these risk estimates that were provided by the Canadian Syncope Risk Score help you in deciding a disposition decision? Please answer below now.